Now we'll hear from Scott Lundy, who is CEO of Arrow Child and Family Ministries. They provide services in many states, not just in Texas. Texas legislation in 2005 mandated privatization by 2011. Efforts did stall, and there's been a more gradual now implementation of privatization around different aspects of child welfare services. So it's also interesting and important to note that Scott chaired the Public-Private Partnership Committee, which put forth recommendations for Texas child welfare privatization model, and he continues to be active on the various subcommittees that continue to advise about privatization.
Thank you, Pat. Good afternoon. One of the downsides about going last is I had written down all these deep and profound points that I wanted to go over, and everybody's hit on every single one of them. But I do want to go through some things related to Texas specifically. Arrow Child and Family Ministries, we are in 4 states. I think that serves us well because each state is very different, and they have some real good things in each state, and then they have some challenges in each state. And it allows us to bring those things to each state so that we have more experience in dealing with it. I agree with what Don said, which is in order to really talk about privatization, you have to go to the why and kind of talk about that process. And very briefly in Texas, there was some regulation that came out, and this was back in 08 or 07. And during that time, private providers were being regulated and there were consequences with regards to incidents. At that time, private providers stopped taking tough kids. And what happened was there was a lot of kids that ended up in hotels with the department's workers. And there was a trust barrier between the provider community and the department. In that also, another point that somebody made is the child welfare system is a very complicated system. And it has many moving parts, and they all impact a child's life and a family's life. And you have to have all of them at the table, because we have a tendency to compartmentalize, and everybody writes a plan for this child, but the plans don't talk to each other, and they don't coordinate. And it's frustrating for the kids, and it's frustrating for the families, and I know it's frustrating for all of us as well. In that situation, the department decided to bring people to the table. And so providers came to the table, and we began a discussion about how we are all a part of the child welfare system. How are we going to address the challenges that we face? In that, we decided to form a public-private partnership. We based it loosely on the public-private partnership in Illinois. We actually brought down the commissioner there from Illinois, kind of talked about what they saw in that role and how that was working for them. In that, we formed our public-private partnership. We included CASA volunteers, our CASA worker, director of CASA. We included 4 judges. We included private providers, the department, educators, all sitting around the table, and we began to talk about our system and what's working and what's not working. In that process was where CPS reform, what we call it, our redesign, was birthed. During that, we really looked at how would we begin to privatize that system and get better outcomes. And so let me say a little bit, and that committee meets today, and there's many subcommittees, as Pat was talking about, that report up into that committee that help evaluate what's going on there in our system. From a privatization standpoint, the department serves about between 2 and 5% of the total out-of-home care children in the state. The rest is served by private providers. The piece of privatization that we're in the process of is very similar to what was spoke of in Florida and also in Nebraska and Kansas. And that is, we decided to go with a blended case rate for a catchment area, geographic catchment area. We've rolled out right now one urban area and one rural area. And it's a cascading rollout. The public-private partnership is a part of the evaluation team with regards to how that's working and what changes we need to make in that process. The benefits of what I see right now, which the urban really hasn't even taken their first shot yet, so they're in startup. We built in between a 6 and 9 month startup phase in order for that private entity that won the bid for that catchment area to begin to ramp up and get ready to serve kids. So they're just starting that. The rural area is already going. Now, I will say the rural area touches Mexico, New Mexico, Oklahoma, and so it's about the size of, it's a very large area. It takes about 9 hours to drive from one side to the other. And there's probably more cactus than anything in Canada. So it is a challenge to the group that is serving out there. Some of the advantages that I see is with that blended rate, the lead agency is able to negotiate for outcomes. So they're able to look at the challenges that they have in the system. They're paid a blended rate for that youth that's in care. And they're able to then see what their needs are and then contract for it. So it takes the system that's there and it brings about a lot more innovation with regards to really looking at what do we need to pay for it. Let's get some proposals out here and let's address these issues. Some of the other advantages are it was set up with some performance-based contracts. In those, one of the performance measures was keeping kids close in their community. So really measuring whether or not we can serve those children within 50 miles of removal. Some of the other measures that they put in as well was keeping sibling groups together, making sure that occurs, placement stability, force safety, and really utilizing the CFSR. In that, we are seeing that beginning to take place. The SSCC is what we call our lead agency, is talking with contractors to really build capacity where they need it. What we saw was we had capacity in areas where it was easy to recruit, but not necessarily capacity where the kids were being removed. So going in with some targeted recruitment to begin getting the capacity where we needed it. Those performance measures are passed down into the subcontractors' contracts as well, so that everybody's shooting for the same goal. Some of the challenges and things that aren't working, or I shouldn't say aren't working, but are challenging. Is in the rollout, when we began to roll out with this case rate and the privatization component of it, was during a time in which Texas, it was during the housing crisis, and it was during a time in which our budget was in significant crisis as well. So everything that was going to roll out had to be cost neutral. And in that, we didn't put any money up front to build infrastructure and to really do the handover. I can tell you now that was one of the biggest mistakes that we made. It's a challenge to build a system with the existing resources. Due to the public-private partnership, the department and the contractors are working hand in hand. They all want the same thing. We're all shooting for the same goal for children. And everybody's coming to the table and listening. But not having some additional dollars to set that up is definitely challenging. Some of the other challenges is they're rolling catchment areas out based on a algorithm, I believe, that was put together by Chapin Hall. And in it, it's a certain number of removals are needed from a volume standpoint in order for the system to be financially viable. That was about 500 removals per year in that catchment area. So the catchment areas are trying to stay around that number. In that, each one is out for bid, so you're getting a lot of different now lead agencies. And in that, they're bringing their own data systems, they're bringing their own billing systems, they're bringing their own trauma-informed care that they recommend and training. So it's challenging for statewide providers because now they're having to deal with multiple organizations, multiple billing systems, multiple data systems. What we are also seeing, which is a success, is the sharing of data. It's almost like the light got turned on. The department was putting out data, but it was an annual data book, and it was hard to get. They had so much data, but it was just hard to tell and get those baselines that everyone was talking about. Now data is being shared so we can make decisions very quickly. It's in real time. So that's an advantage. The other thing that's a challenge, I've never worked in the public sector, and there are many folks in the public sector that have not worked in the private sector. We have different goggles, and so really when we're talking about serving kids, and not one is better than the other or worse than the other, they're just different. But in going in and learning how we're going to serve kids, there's times that we're speaking Russian, it seems like. So you really have to spend a lot of time trying to get to a point of communication and understanding to where you can move forward. So that's one of the other challenges as well. I think that's basically it right now. We're continuing to do these rollouts about every 6 months. So far, everybody's in a very upbeat mood, and we're seeing some really positive things. So, but I think part of that was because of the public-private partnership. Thank you.